I think most important thing is honesty. The person who writes blogs should be very honest about the data, and he should have a specific purpose in mind. Like, why is he writing a blog? Whom he is trying to address. Like, people can write blogs for patient, people can write blogs for other fellow oncologists, people can write blogs for nurses. So first you need to be specific whom you are trying to give the message to, and then you need to be very clear and honest about the message. And I think one important thing is that person should not have any relevant or important conflicts of interest, because a person who is doing a blog, if he has conflicts of interest, then he will be biased. So the one very important thing for the audience, for the reader, is to be confident that what the blogger has written is true and honest. And one more thing is, unlike academic writing, it should be very personal. It should not it should be engaging. The reader should feel like the blogger is in front of him and he is talking and having a conversation. I'm a very active user of social media in oncology. Like, I do Facebook, I tweet, I blog. And I think this is very important both for health professionals and for the public, because until now these two important dimensions of cancer treatment used to be completely separate. Like, health professionals are in their own world and patients are in a different world, and there is a sort of gap between them. So this social media use helps to bridge that gap, and the patients get to know the oncologist more closely in a little bit informal way, and the oncologist also, it helps us to know how patients are feeling about all these developments. Like in Twitter, I have interacted with so many patients, and sometimes the patients come up with such nice ideas that we had not thought about before. And it's also very interesting and novel to hear about what patients are thinking about this high cost of treatment, both from the developing and the developed world, and whether their point of view is different, and about side effects, toxicities. We as professionals, because we don't get those toxicities by ourselves, only the patients know how it feels. Like, we say this drug has a toxicity of fatigue grade 3. We do not exactly know what a grade 3 fatigue means. It differs from person to person. So it always helps to communicate with patients in an informal way through the use of social media. But of course there are some caveats. We need to be very careful. We need to preserve our medical ethics, and we should refrain from giving specific medical advice in social media, and we should maintain the integrity of a doctor-patient communication. So it's a very delicate balance, but I think it has more pros than cons. And I think I actively encourage all the oncologists to be active in social media.